Howdy, Pima students. Welcome to Chapter 18, Immune Disorders 1. So there's 4 types of hypersensitivities, so we'll have 4 videos. Actually, no, we'll have 3 videos because we'll do this video, Hypersensitivity Type 1, and then the next video we'll cover Hypersensitivities Type 2 and 3, and then the next video will be Hypersensitivities Type 4. Hypersensitivities. So what are they? Well, they're types 1 through 4. Type 1 hypersensitivity is mediated by immunoglobulin E, or antibody E. That's an immediate type hypersensitivity, and if you'll notice, it involves an antibody. Hypersensitivity type 2 also involves antibodies, IgG or IgM. And type 2 reactions include cytotoxic reactions, so that reactions that can destroy cells. Type 3 is also an antibody-mediated hypersensitivity involving immune complex reactions. And then check this out, type 4 hypersensitivity is T lymphocyte mediated. This type 4 is not antibody mediated, so I'll put an antibody with an X through it. Okay, so type 1 is an immediate hypersensitivity, and it's an allergy, and you probably either have allergies or know someone with allergies, so you have some real world experience with allergies. Type 1 hypersensitivities are dependent on antigen epitope antibody binding. So here's our hero, the antibody, the Y antibody. Here's the epitope antigen binding sites on the ends of the Y. So that's where the antigen or epitope would bind in this reaction. IgE is a monomer. That means it's just a single structure. And it's the antibody, IgE is the antibody of allergies. And here's a little girl sneezing with some flowers. So just in general, sort of an overview, IgE triggers mast cells and basophils. So hopefully you remember basophils. That's a type of white blood cell, and mast cells are related to basophils. And when the mast cells or the basophils get triggered, they release histamine in response to an allergen, like maybe whatever's in these flowers or some pollen. So an allergen basically is the same thing as an antigen, but an allergen is an antigen that causes allergies. So hopefully you really have been digging on antigens, because we talked a lot about antigen epitopes in the immune system. Okay, oh, this is a cartoon of IgG. It's a monomer. And if you are a non-allergic person, if you are exposed to antigens in the environment, any kind of antigens, then you normally make IgG. You don't make IgE. So this is just a review from the chapter on B cells and T cells, so the adaptive immune system. So here's a whole bunch of different types of B cells, and they've got their B cell receptors. They're calling it an antigen receptor in this cartoon, but it's also called a B cell receptor. And remember that at the tip of these B cell receptors / antigen receptors, there's a certain shape on each one of these individual B cells. And in this cartoon, it's showing that this shape at the tip of this B cell receptor is specific for this yellow diamond antigen. And then when the B cell and its B cell receptor binds this antigen, you could have a helper T cell there to fully activate the B cell, but the B cell undergoes cell proliferation and forms a clone. So you can form a clone of B cells, and then they differentiate into a clone of plasma cells, and the plasma cells make antibodies. And then the antibodies all have the same tip that the B cell receptor has here. So all these antibodies in your bloodstream now will be looking for yellow diamonds. Oh, yeah, I'll color it in yellow, but this should have been actually, yeah, there we go. There's a yellow diamond. Okay. And then also a clone of memory cells are formed in addition to the clone of plasma cells. So this is what happens normally. This is a review for you. If you are a non-allergic individual, if your B cells recognize an antigen in the body, anywhere in any of the interstitial fluids, this is what happens normally. But what if you are a person who has allergies? Well, let's look at the cartoon. So now here's an allergen, which remember is an antigen. So that's involved in these type 1 hypersensitivities. So really the whole, you could say this whole thing is allergen, and then these little green triangles, those are specifically the epitopes that will initiate an immune response. So here you are, you're an antigen presenting cell, kind of looks like a phagocyte. So the antigen presenting cell, it's a macrophage, it will recognize the allergen and it will engulf it, and it will chop it up into little pieces. So hopefully this sounds familiar because we went over this in the immune system lectures. And then these epitopes from the original allergen will be packaged onto these MHC2 proteins. So the antigen presenting cells have these MHC2, so major histocompatibility protein complex 2, presents the epitope to a helper cell, a helper T cell. And then it doesn't show in the cartoon, but the B cell will also will have recognized this epitope, and the helper T cell will, and this is all happening in a lymph node, by the way, the helper T cell will secrete the cytokine IL-4 to fully activate the B cell into a plasma cell, and then the plasma cell will secrete IgE, which is the antibody or immunoglobulin of allergies. And now this is interesting. So IgG, at this point, you might think that with its little tips here, it would go out and it would look for those green diamonds, because that's what this original B cell would be looking for. But it doesn't. What happens is, I don't know if you remember, there's in an antibody, the stem region. The stem is also called the Fc region of an antibody. Well, these IgE antibodies will bind to Fc receptors, so it doesn't really show it in the cartoon, but there's Fc receptors that bind the Fc region of these IgE antibodies. So Fc receptors are in mast cells, basophils, and eosinophils. So now you've got your mast cells, basophils, and eosinophils with the antibodies stuck in the cell membrane. What's going to happen next? Did I set up the story to excite you? Hopefully I did. So let's take a look. When allergic individuals are initially exposed to the allergen, so that's what's happening up at the top of the cartoon. So for example, pollen, it's out in the environment, they undergo this process of sensitization. So this whole process we just talked about is called sensitization. So these, what's getting sensitized? The mast cells, the basophils, and the eosinophils. They're all getting sensitized. And we talked about this. Allergic individuals produce IgE instead of IgG in response to an allergen or an antigen. And then I just talked about this. The Fc portion of IgE binds to Fc receptors on these mast cells, basophils, and eosinophils, sensitizing these cells to future exposure. So if you are an allergic individual, this process of sensitization happens first, and you don't feel anything upon the first exposure to the allergen. Because look, nothing has happened. No histamine has been released to cause your allergic symptoms. But upon subsequent exposure to the allergen, so check it out in this cartoon. So this could be a mast cell, basophil, or eosinophil. This guy right here kind of looks like a basophil because it's got all those dark purple granules, and you can barely see the nucleus. But upon the subsequent exposure to allergens, so here's the IgE antibody sticking out of the basophil cell membrane. Here's the second, same allergen, so it's the same allergen that you were exposed to in the first place, binds to the antigen binding portion of the antibody. And when that happens, you get some biochemical reactions, causes, inside the cell, causes release of all these inflammatory molecules, including histamines. This is probably the most famous one, because when you have an allergic reaction, what do you take? An antihistamine. But it's not just histamines that are released from these granules in the basophil. It's other molecules called kinins, proteases, leukotrienes, prostaglandins, and other inflammatory molecules that they don't mention here. So second exposure to the allergen, degranulation of the sensitized cells. Remember, they were sensitized. What caused them to be sensitized is these IgE antibodies bound to their cell membranes. Okay, so we talked about this. The allergen binds IgE antibodies on the surfaces of sensitized cells. So if you're a cell and you're not sensitized, it doesn't matter. The allergen won't bind to you. And it causes degranulation, so you release chemicals, including histamine. Then these chemicals, what they do is they generate symptoms of hypersensitivity type 1, including all the things you know. Probably, if you don't have it, other people do. This is a little more serious: respiratory distress, so a little trouble breathing, hay fever, rhinitis, which is a runny nose. Rhinitis. Well, rhinitis is a runny nose. It's the hay fever that causes it. You get watery eyes. There's inflammation around the area. Some people can suffer from asthma or an increase in their asthmatic symptoms, and hives, urticaria. Hives are also called urticaria. And here you are, runny nose, watery eyes, and hives or red patches on your skin. In addition to what could happen to us with things like pollen, another example of a type 1 hypersensitivity reaction is you can get watery eyes after exposure to animal dander. So pet dander, what is it? Protein secreted by oil glands in an animal's skin, or it's in their saliva. Some people are allergic to that. Sometimes it can take 2 or more years to develop an allergy to pet dander. How do you prevent it? If your pet's causing you allergies, maybe have your bedroom be a pet-free zone. don't have carpets, wash the animal regularly, and frequent vacuuming. Also, you can get allergy shots. Forgot I put this in. Dr. Jenny McCarthy, the anti-vaxxer. Anyway, so we talked about this cartoon. So we talked about sensitization. We talked about degranulation, and then the degranulation of these chemicals cause things like watery eyes and runny nose. So why do some people have high levels of IgE and develop allergies? Why do some people get allergies and some don't? Some scientists think that exposure to antigens like cigarette smoke or dust mites or molds can make people hypersensitive. Other scientists think that exposure to all these above mentioned antigens make people less likely to develop allergies. So we should probably check in with Dr. McCarthy, see what she thinks. And yes, I'm being sarcastic. Okay, a little more on degranulation and other things that it can cause. So here's our cartoon again. Remember, this antibody sticking out of the cell membrane of the mast cell is IgE, and IgE, the Fc portion of IgE is bound to this Fc receptor, which is in the cell membrane of this mast cell. Subsequent or second exposure to the allergen binds to IgE. You get a whole bunch of biochemistry that we didn't really talk about, but that biochemistry causes release of molecules like histamine. And then histamine and all these other inflammatory molecules cause a whole bunch of different signs and symptoms in addition to like watery eyes and runny nose. So mast cells, so now we said this cartoon could be a basophil, eosinophil, or mast cell. So now let's talk about mast cells and what happens when they degranulate. So mast cells are special relatives of white blood cells. They contain histamine and all these other inflammatory chemicals listed down here. What happens is they can, so this plus sign means stimulate. They can stimulate contraction in smooth muscle cells, SMC, smooth muscle cells, of the bronchi, GI tract, uterus, and bladder. So I show a cartoon down here of the bronchi and the bronchioles. So this is the sort of the bronchiolar tree in your lungs. So you guys probably know this. You start with the trachea, and then the trachea branches into right and left main stem bronchi, and then the bronchi get smaller and smaller and smaller, and they get different names as they get smaller, and they branch out into this bronchial tree that makes up your lungs. But here's a cartoon of a normal bronchiole, and then all this brown stuff out here, these are smooth muscle cells. It's like ribbons of smooth muscle cells. And then here's the lumen of the bronchiole. So air travels through this basically. And if the smooth muscle cells contract, that means this airway gets smaller. That means less air can get in the airway, and it's harder to breathe. You stimulate contractions of the GI tract. That's stimulating your intestines, for example. You can stimulate with histamine and these other inflammatory chemicals can stimulate contractions of the uterus. And also your bladder. All these have smooth muscles in them, and they can all be stimulated. The smooth muscles cells can be stimulated. They contract in all these different organs. You can also, with a mast cell release of histamine, stimulate relaxation of smooth muscles in these small blood vessels. Then they dilate. So here's an artery. Here's an arteriole. These guys are capillaries. And you can see, look at this wall. This is all smooth muscle. And when this, and then these are endothelial cells that line the lumen. of the blood vessel. So when the smooth muscle cells relax, that means the diameter gets bigger, and what can happen is it gets too big, these endothelial cells can start coming apart, and then you get leaky. Then you get a leaky blood vessel, and blood leaks out into the tissue and pools there. And then that means that tissue where this is happening, it gets swollen and it gets red. Mast cells' release of histamine can also stimulate nerve endings, so itching. Probably have had that before if you have allergies. Nerve endings are being stimulated, that causes itching and pain. And then mast cell release of histamine can also stimulate bronchial mucus secretion. So I think I have another cartoon for this, but mucus can thicken this airway, and with a whole bunch of mucus in here, oh, what color is mucus? So a whole bunch of mucus in here can make the airway diameter smaller. Okay. So basophils, like the mast cell we just saw, are filled with granules, so we talked about that, of inflammatory chemicals, and they degranulate when they bind to IgE in their plasma membranes and upon subsequent exposure to an allergen. And then smooth muscle cells are stimulated, so we just talked about that. Eosinophils, they usually are there to destroy parasitic worms, but if you are undergoing a type 1 hypersensitivity reaction, so an allergic reaction, that results in accumulation of eosinophils in the blood. So if you do a differential white blood cell count, and you see someone's eosinophil count is high, that means they could have a parasitic worm, or they could have a type 1 hypersensitivity reaction. Okay, here's some favorite allergens. So the fungus Aspergillus flavus, ragweed. Oh boy, ragweed gets a lot of people. And then this is kind of gross. This is a dust mite. And these are all scanning electron micrographs, by the way, because these are really small things. And they're all inhaled. You can inhale all these things and become allergic to them. The site of the reaction, the allergic reaction or the type 1 hypersensitivity reaction, depends on the portal of entry. So remember your portals of entry. You can go in through the mouth, the nose, etc. Some clinical signs of type 1 hypersensitivities. You could have, in addition to a localized reaction, you can have a systemic reaction in this type 1 hypersensitivity. So when your mast cells degranulate and you get a copious amount of histamine, that means a buttload of histamine, and a whole bunch of other inflammatory mediators are released in the bloodstream en masse. So your blood is kind of overwhelmed with these inflammatory mediators. This may exceed your body's ability to adjust to all those inflammatory mediators, and this could cause acute anaphylaxis, aka anaphylactic shock. So just some signs of anaphylaxis. You can get some hives here in the face. The tongue can swell, and now you can't swallow. Rapid swelling of your throat tissues. So now it's hard to get air to the lungs. Some more signs and symptoms of anaphylaxis. So these are the non-lethal ones so much, but the swelling of the conjunctiva. So that's around your eyes. This is where your eyes would be. In the central nervous system, signs and symptoms. Lightheadedness, you lose consciousness, confusion, headache, anxiety. You could have respiratory signs and symptoms of anaphylaxis. You get shortness of breath, could be wheezing, hoarse, pain with swallowing, a cough. You could even, sign of anaphylaxis could be pelvic pain and loss of bladder control. So there's a lot of signs and symptoms of anaphylaxis. So you remember that a symptom is something that you can't measure, and a sign is something that you can actually measure. So this would be a sign, fast or slow heart rate, because you could actually measure that. What do you use to treat this? Epinephrine is immediately used to treat a very severe allergic reaction. If that's not available, the patient could die within minutes. So a lot of people, if they know they have these reactions, they carry this EpiPen. So this is the cartoon I was talking about. So here's a normal bronchial. It's got a normal diameter. In an asthmatic bronchial, you've got all this exudate, all this pink stuff that, and then this yellow stuff on the inside that decreases the diameter here of the bronchiole and makes it hard to breathe. Could lead to rapid suffocation. So anaphylaxis in the lungs, the bronchial smooth muscles, so these guys here, they contract violently. When they contract, the diameter gets smaller. Mucus builds up, so here's mucus building up in the airways, and they get blocked. I don't know if you can see these here's a little red and a blue. Here's red and a blue. Those are arteries, or tributaries of arteries and veins. But fluid will leak from the blood vessels. And this overall can cause swelling of your larynx or your voice box. Fluid leaking out of the blood vessels causes hypotension or low blood pressure. Really low blood pressure can lead to shock and then death. And then you get contraction of smooth muscle cells in the intestines and bladder as well. We talked about that. A common cause to get a hypersensitivity type 1 reaction is a bee sting. First bee sting, you get sensitized, so nothing happens. You make the IgG, just like we talked about in the cartoon. And then the second sting, it could even be years later. That's where you can go into anaphylactic shock. Other allergens, you guys probably know this. Peanuts, some vaccines, especially if they're made in eggs and you're allergic to eggs. An antibiotic, you could be allergic to that. All these other things. There's a lot of things you can be allergic to. How do you diagnose this? So I had this done. So they just, they dilute the allergen, and then they inject just this tiny amount into your skin here. You can test dozens of allergens at a time, and if it's sensitive, it'll get red pretty quickly, and then they know what you're allergic to. Apparently, I don't like ragweed, but I think that's really common for people in Tucson. Okay, how do you prevent type 1 hypersensitivity reaction? First, you have to identify the allergens. So this is kind of cool. They have these mite-proof pillow covers, so the dust mites can't get in. And then you should know if you're going to get a vaccine, you should know if you're allergic to eggs. Then all these other things. You can use a dehumidifier that could reduce mold spores. Find out if you're allergic to the pet before you get it. Avoid foods like shellfish and peanuts that often cause reactions. You can get allergy shots too. That's called immunotherapy. And this is just kind of a cartoon showing the details of it if you want to look into this. But mostly I think clinicians are not sure how the allergy shots work. But in about 2/3 of the patients, the symptoms go down by 50%. but you have to repeat them every 2 or 3 years, so that's kind of interesting. But look at all the cells that we've already talked about are involved in suppressing basically the production of IgE. So we've got our heroes here. We've seen these guys: B cells, Tregs, regulatory T's, dendritic cells, helper T cells, etc. I think that's it. No, it's not. My bad. We talked about this earlier. You can use antihistamines. You can use Benadryl for allergy, for an allergy medication.